Hello friends, I'm Anuja and I welcome you all to this exclusive show that focuses on kidney care, Stop Kidney Dialysis. Friends, kidney is a vital organ of our body, and if even there is the slightest complication in the kidney functioning, the entire body goes for a toss and it starts dysfunctioning. And then what you're suggested is either dialysis or kidney transplant, which does not give you a permanent result or a permanent relief. So what is the other alternative? What about Ayurveda, the ancient medical science? Can it treat kidney failure permanently? All this we'll get to know today on this show because we have with us the world famous 5th generation Ayurvedic kidney expert, Dr. Puneet Dhawan. So without further delay, let me welcome him on our show. Welcome, Dr. Puneet.
Thank you.
We welcome you to the show. So friends, today we'll be discussing allopathy versus Ayurveda in terms of kidney failure treatment. So if you have any queries, any questions regarding the same, please feel free to contact Karma Ayurveda and Dr. Puneet. Contact numbers are already there on the screen. Dr. Puneet, here I really want to know that in spite of that allopathy treatment, why don't people see any improvement in the kidney failure cases?
Yes. If treatment will be there, then definitely improvements are going to be there. As far as the allopathic treatment is concerned, there are nephrologists, the doctors who deal with the kidneys known as nephrologist. He's going to prescribe you some medicines, and those medicines are used for controlling the blood pressure, are used to maintain the calcium level, hemoglobin level, are used for diuretic, so that there is no swelling in the body and the urine output is normal. Again, which is unethical to use a diuretic because it pressurizes the kidney to pass the urine. So these are the kind of the medicines the nephrologist is prescribing. These medicines can be prescribed by a general physician as well. So what's the need of nephrologist? Today we have scientifically proven that the kidney failure treatment can be there, kidneys can be revived, and the GFR, the glomerular filtration rate of the kidney, the rate at which the kidney is functioning, the rate at which the liquid is being taken out of the kidney can be improved. The functioning of the kidney can improve. We have so many patients whose GFR are regularly increasing. You can see them on the YouTube as well as we have so many reports that I'll be sharing with you shortly.
Dr. Puneet, we've also noticed a gradual increase in the creatinine levels in allopathic treatment. Why is it so?
Yes, of course, when the patient is undergoing allopathic treatment, even after that, there's a gradual increase in the creatinine level. Patients comes to know about the kidney failure when the creatinine level is about 1, 2 or 3. And this creatinine level increases to about 6, 7, 8, and at that particular time he is being advised dialysis. Then he goes for the dialysis, and then after a period of time it's being told that dialysis is not sustainable. We have to find an alternate solution of this, and after that he just goes for transplant. And even after that transplant, there are so many complications that are associated with the transplant. Transplant is not a permanent solution. Even the average age of the transplant is considered to be about 5 years, and even if it goes for 1 or 2 more years, then ultimately it's going to fail. There are so many immunosuppressants, there are so many medicines that are being continued along after the transplant. These medicines are meant to reduce the immunity, and because of these medicines there are so many other diseases that can be there, including the hepatitis, the TB and so many other things. Because of these immunosuppressants, the patient's immunity gets hampered in a big way, and there are chances of getting so many other diseases as well. So what's happening all this? We started off from a creatinine of 2, 3, goes to dialysis and then goes for transplant and again goes for dialysis. So this is a circle. This is a never ending circle because there is no permanent solution of this. Our treatment focuses on the root cause of the problem, root cause of the issue. The glomeruli that are filtering, the capillaries that are working, are they improving or not? We'll focus on that. If the kidney function, the function of the glomeruli is improving, then we don't need to go for all this, even if you are planning for dialysis or a transplant. What can be better than this if your own kidney can improve, if your own kidney can work in the same way?
That's absolutely correct. So please feel free to contact Karma Ayurveda. Contact numbers are already there on your screen. Dr. Puneet, we have received a mail. They have a query regarding their kidney failure treatment, so I'll just share it with you. So we have an email from Saudi Arabia, and by Shehzadi Hussain. Her creatinine level is 840 and she's undergoing dialysis thrice a week. So what's the situation?
She's undergoing dialysis thrice a week. So this dialysis is going to go for a lifetime. You need to go to the hospital for 3 times a week for this dialysis. There needs to be some solution. If you go to a hospital, then you must get free from the ailment, but this is going to go permanently. With the medicines, the frequency of the dialysis will reduce. For example, if you are undergoing dialysis now to thrice a week, it will come down to twice a week, it will come down to once in a week, and then once in 15 days. This way the dialysis frequency will reduce. And how is this going to reduce? This is going to be reduced according to the protocols. If the GFR is about 25 ml per minute, then there is no need for dialysis. This is according to the books, according to the protocol, that the GFR reaches 25 ml per minute, the requirement of the dialysis is not there. So what we'll do, we'll increase your GFR gradually with our medicines. The GFR will increase. We have got a test for the same. You can do those tests at your native place, or if you wish, you can come over here and we'll do the required test. And as a result of which the frequency of the dialysis will be reduced simultaneously along with our medicines. So this way we are going to work, and gradually after decreasing the frequency of dialysis, the dialysis will be stopped.
So friends, if you have any query regarding kidney failure treatments, you can personally visit Karma Ayurveda and meet Dr. Puneet in New Delhi. If you're not being able to do so, you can get connected via WhatsApp, email and phone. There are patients coming across the globe and taking their treatments. We do have an international helpline number to keep you connected with Karma Ayurveda, which is working since 1937. Dr. Puneet, we've been observing that you talk a lot about the GFR thing. What is it exactly?
Glomeruli are those capillaries whose main function is to filter. Glomerular filtration rate is the rate at which the kidneys are filtering. The rate at which the normal kidney should filter is about 80 to 90 ml per minute. On a compromised kidney, it can get down up to 2 to 3 ml per minute. So our role is to increase the GFR to a level that the patient is out of the dialysis protocol, and sooner or later he goes into the normal protocol. I'll be sharing some reports with you so that you get a better clarity of how the kidneys are improving and how the patient's GFR are improving. We are having so many reports, I cannot share it over here, but you can visit us, you can see those reports on the YouTube, you can meet those patients on the YouTube. So there is a patient whose GFR is, whose creatinine level is about 9.74. When the patient came to us, the creatinine level is about 9.74. And then after, the creatinine level came down to 8.42. The patient was on dialysis, and then the creatinine level came down to 3.40. 3.40 is the creatinine level. The patient was on dialysis when this treatment was started, and after that the creatinine level is about 3.40. The requirement of the dialysis is not there anymore. Another report is this. In this, the creatinine level is 11.5. 11.5. This patient was advised dialysis. He contacted us, started the medicines, and as a result of which the creatinine level came down to 4.9. 4.9 is the latest creatinine level, and the patient is still undergoing our treatment and still observing the improvements. Next report is this. In this, the creatinine level is about 1.8. 1.8 is the creatinine level at which the patient contacted us. After about 3 to 4 months of treatment, the creatinine level came down to 1. All these reports are from different parts, are from the different laboratories. So this is what I was talking about, the GFR, the glomerular filtration rate of the kidney. Kidney failure is considered to be a progressive disease. It keeps on increasing by itself. And in this report, the patient's GFR is about 30.57. 30.57 is the patient's GFR. Conducted repeat GFR after 3 months, the patient's GFR increased to 38.85. GFR increased to about 38 point. There is an increase of about 8 ml per minute filtration, which was earlier rapidly decreasing. It's now improving, it's increasing. It increased from 30 to 38 ml per minute.
Doctor, there is kidney shrinkage and then it leads to kidney failure, and then at one point in time the patient is suggested kidney transplant. So is that the only option?
Yes, I would like to put some light on this. Kidney transplant, I don't consider it even under the options, because there are so many patients whose GFR are regularly increasing with our medicines, and what's the need of undergoing the transplant? Transplant is your original kidney is being cut, and instead of that a donor kidney is being put in the place, and the nephrologist who is not able to control your original kidney, how can your donor kidney can improve? Donor kidney can be there, because there are so many complications with the donor kidney. There are immunosuppressants that are undergoing along with the donor kidney. There are high chances of kidney failure. Success rate is extremely low with the kidney transplant cases. And after that transplant, you have to undergo again a repeat transplant, or you have to undergo dialysis. You started from dialysis, gets back to dialysis. So what's the need of the transplant in that case? So this way, this is going to be the vicious circle. It's going to be like a vicious circle. And as far as the kidney shrinkage is concerned, kidney shrinkage does not lead to kidney failure. This is just a myth that the kidney shrinkage will lead to kidney failure. There are so many patients whose kidney size are small, but still urea, creatinine, sodium, potassium, other electrolytes are normal. On the contrary, so many patients whose kidney size is normal, but urea, creatinine and every other thing is imbalanced. So there is no direct relation between the two. We have to look at the strainer which is filtering the GFR, is it improving or not? We have to focus on that. In both the cases, we have to see that the GFR improves. Even a child has a smaller kidney. How does it works? Yeah, that's possible that the filtration, the circulation of the blood is going to be less in a smaller size kidney. But instead of filtering 1 liter, say for instance, it can filter half liter, but still it's going to filter. We have to look for the strainer. Is it normal? Is it normally functioning? Is it properly there? Is that the function of the strainer is improving or not? We have to see for that.
Dr. Puneet, is it possible that by Ayurvedic approach or herbal medicines, you can revive the kidney and rejuvenate the kidney once and for all?
Yes, definitely, it's possible. With our medicines, 80 to 90% of the patients do improve. There's an improvement in the glomerular filtration rate. We are doing researches on kidney, and our focus is only on the kidney patients and who are coming from all over the globe, and there are improvements with our herbal medicines, with our herbal preparations, with our Ayurvedic medicines. There are improvements in the patient's GFR. There are patients who were advised transplant, who were undergoing dialysis. There are so many testimonials with us that those patients have recovered now and are on the continuously improving. So many patients are continuously improving as well. Today, we have scientifically proven that how the kidney function can improve. And this is by the logic. This is based on the medical reports. Before, this was the GFR, and after, this is the GFR. Ayurveda is a very ancient science, said to be more than 5,000 years old, and we are practicing the same since 1937, focusing on the kidney patients' health and kidney patients' improvement. And many of patients have taken advantage of this treatment, but you need to follow some guidelines that we are going to prescribe you, that we are going to give you from here. We are going to give you some diet restrictions, some diet chart we are going to prescribe you. And every diet chart is going to be personalized, going to be accordingly your reports. If someone is having more phosphorus, then we have to see how much milk we have to give to him. If someone PTH is increased, we have to see over there. If hemoglobin is increased, we have to see. If hemoglobin is reduced, we have to see. Calcium is reduced, we have to see. We have to take in consideration each and every factor before preparing a diet chart. So we'll be giving you medicines, we'll be giving you the diet chart and some guidelines that needs to be followed in discipline. If you follow those, you will see those improvements that you are expecting.
I would like to thank you, doctor, for this initiative that you have taken to treat the people regarding the serious illness which makes, everyone just lose their mind and health. Thank you so much.
Thank you.
So friends, if you have any doubts regarding kidney failure, complications and its treatment, please feel free to contact Karma Ayurveda, which is working towards kidney care since 1937. Dr. Puneet, the 5th generation in Ayurveda with his team, will always be there to treat you effectively. If you have any query, you can share your feedback, you can share your response on the comment box below the video. Do like and share our video, and do not forget to subscribe to the YouTube channel Karma Ayurveda. Just ring the bell icon.